0 to 100%, what's the difference for you?
80.
Good. Tell me what's going on.
Yeah, you know, I came over here, you know, because I follow you on Facebook, you know, and then, you know, I see, you know, I have a problem with my back, my knee, and my foot, you know.
Both foot, right?
You know, my knee and my foot, you know, and then, you know, you see me how I walk, you know.
How long did you have this problem for?
Around like almost 2 years ago.
Did you have any kind of accident 2 years ago, or did it just kind of happen?
No, just, you know, start slowly pain and this and that, you know. And I went many times to the hospital, here, there, and nothing, you know.
So you went to hospitals?
Yeah, I went to the hospital, but only he they check me only for pain, you know.
Who did you see in the hospital? Orthopedic, neurology,
No,
physical
just
therapy?
just normal doctor.
Just general doctor,
Yeah,
generalist?
no, general, yeah.
They just talk about your pain
Just talking
symptoms?
about the pain, give me pills, you know, nothing else.
Did it help?
Yeah, when he give me the pills, like something ibuprofen or Motrin, you know, strong, 800 milligrams, you know, and then, you know, it go away the pain. But, you know, the more important matter, like how I walk.
Walking is a problem, yes?
Walking is the problem.
You see how swollen your foot is?
Yeah.
You also notice that there are angles here like this. You also know that your foot is kind of angled like outward here like this. This is from birth. So since birth, you had this kind of foot here like this, where your entire foot is rotated outward. Is that correct? And then your entire leg has been rotated outward because of that.
Right.
So entire leg is actually rotated outward, and then your entire foot is actually kind of crooked inside here like this. That makes it hard to walk.
Yeah.
And then on this side, entire leg has been rotated outside.
Right.
And then your entire foot is actually rotated outside also. So it's
Right.
almost as if your entire leg is actually kind of outside this way, and then your entire foot is actually outside this way. So almost like an X.
Right.
So when you're walking, it's actually very difficult for you to be able to walk.
Yeah.
First of all, when you actually have this kind of the changes, like your entire leg being outward this way, and then your foot outward being like this, almost like an X, you know, like an X shape. X shape. That actually is the main cause of you having difficulties walking. And then in order for you to be able to have this kind of a strong ankle like this is actually something that has to be solved with surgery. So you might be asking, are you supposed to have a surgery and just call it a day and then will you walk normally? Believe or not, this you have to listen really, really carefully. If because of the fact that your ankle is rotated this way, because of the fact that your entire foot is entire leg is rotated this way, you might be asking to me, am I supposed to have surgery and will I walk better? If you go to a surgeon, not a general doctor, a surgeon will tell you that's exactly what you should do, and they are right. But the thing about this is that you'll only be normal here and here. What about your knee and above? That's one of the questions that you have to ask yourself. So what I need to do is, and what you need to understand is you have to normalize your body. If you're my brother, I would not let you do any kind of procedure to your body, any kind of surgery to your foot or your leg until we stabilize here first. You already know exactly what you have seen on your lower back area, so I'm not going to pretend that you have not seen what I just showed you, but that has to be fixed first. Does it make sense to you?
Yeah.
I'm going to go ahead and give you treatment here today. I'm not going to do surgery. I'm not going to cut you open. I'm not going to give you any medications. Most likely, I won't be able to change your knee shape. I won't be able to change your foot shape. You're going to still have those kind of X kind of shape of your knees or your legs and your foot. But what I'm going to do is I'm going to normalize your body best of your ability, best of your possibilities. That's exactly what I'll do for you. That's good. So this is where the mobility of your walking comes from, your lower back area. So if you have those kind of deformity to your knees and your foot, you cannot walk normal, and then there will be some kind of problem will be happening on your lower back because of that reason. Does it make sense to you? So this we have to take care of here first. After that, we have to go from top to bottom. So this has to be something that I have to take care of more than anything else. Sounds good? So just by me looking at your entire body, I already see a lot of stiffness. This, you think is fat?
No, it's
swelling.
Something swelling.
This is all swelling. This is all water. This is not fat. This is swelling. There's some kind of things that are going on in your lower back that your entire back here is actually very, very swollen. Yes, right here. So I'm going to go 5, 4, 3, 2, 1. Pain right here?
Yeah.
Pain?
Yes.
How about L5 right here?
Wow.
A lot of pain, yes?
A lot of pain.
How about right here?
Little bit.
A little bit, but this is a lot of pain, yes?
Yeah.
So much pain, too much pain, yes?
So much pain.
That's the reason why you have a lot of pain when you're walking. Is it correct? It's that spot, yes?
Yes.
This spot is really, really the one that's really
Right.
painful,
And,
yes?
and I think you feel it, the bone. You see the bone, how you feel it?
Yes.
It's like a little bone out.
Yes.
Yeah, right there. You know?
So if you have this much of inflammation, this much nerve pain, usually people have hard time peeing. Do you have a hard time peeing? Do you have hard time with urina?
Yes.
Sometimes?
Yeah, sometimes, yeah.
You see this, and I showed you here before. You see this.
Yeah.
This is your spine side to side. It's supposed to look like this. This is supposed to be right on top of here, as you can see. This is supposed to be right here like this. Do you see this?
Yeah, it's so upside down.
This much portion of your sacrum, which is right here, is not even touching any bones.
Wow.
Which means your entire spine is resting on this portion of sacrum only, maybe the top 30% right here, the front 30%. 70% is actually not touching any kind of bones.
But is something is broke or?
So when you were a child or when you were growing up, you have broken this part right here.
Wow.
You have broken both of the sides and the entire bone came out. But everything is connected with this disc. So your entire body has come outward. So you're always feeling like you're walking like almost like a rocket.
Yeah.
The reason why is because this is slipping outward. So you might be asking, is that the reason why you have all the problems? That's absolutely the reason why you have all this problem that you actually have. This is going to be like this. Then you might be asking, okay, so I got it. How the heck are you supposed to fix me, Dr. Ali? You might be asking me this. How are you supposed to fix me if that's the case? If I have a broken bone here a long time ago, what are you supposed to fix me? That's what you might be asking.
Yeah.
My answer is very simple. Put this bone here.
To put it back.
Don't move this one, because if I move this one, I'll make you worse. Put this one here. You'll walk better.
Okay, doctor.
That's exactly what I'm going to do.
Thank you very much.
Okay. Go ahead and walk for me, please.
You ready?
I am always ready for you, sir. You already know that you're not walking straight. I don't have to tell you exactly how you're walking. You're walking very circumducted. That's the professional term. You're swinging your both of the hips outward. Go ahead and turn around and walk for me, please. Okay, walk for me. And then you said that it has gotten worse for the past 3 years.
Yeah.
A little more. There you go. That's it. Go ahead, walk for me, please. What's the difference?
Yeah, a little bit better.
How much better? What's the difference?
Like 60.
60% better.
60% better.
Turn around and walk again. You still have foot deformity. You still have arthritic knees. You still have the broken bone on your L5, lower back. What I have done was one sacrum bone. Right here, yes?
Right there.
There we go. There we go. Did you hear that? Now I'm going to be using this. Now I am using this and I'm going to try to work some of the muscles over here so that you can walk better, okay?
Okay, doctor.
After all the muscles, foot adjustment, knee adjustment, lower back treatment, how do you feel?
Yeah, better.
Okay, 0 to 100%, what's the difference for you?
80.
Good. You're actually using all your muscles, right? Feels difference to walk, yes?
Yeah, more flexible, like more.
Hi, this is Dr. Lee. Let's compare before and after. Before the treatment, he had excessive side-to-side swing, but such swing has diminished significantly after one single treatment. Notice how much softer he's putting his foot and knees down. He does not have as much drastic angle between his knees and his leg. This is the reason why he's feeling 80% improvement. Thank you very much. Take care.